Making things transparent for both sides of the market is really important to actually delivering excellent service. And I think if there's one thing that's missing in healthcare, from my perspective, is that things are still far too opaque, particularly for the buyer of healthcare. I don't know what anything costs in the US healthcare market before I've consumed it. That is unlike every other industry in our country. And I get that delivering healthcare is complicated. I get that things come up. But that's not different in the hospitality industry. That's not different in the travel industry. That's not even different really in complex retail or construction or other industries where there are a lot of change orders and a lot of change that occurs in the consumption of the service or the product. But I think, again, really powerful intermediaries over the course of decades have entrenched themselves in the middle, basically in between the buyer and the seller of healthcare, largely to enrich themselves, in my opinion, and have done so by creating a black box so that neither the supplier, the provider of healthcare, the physician, the nurse, the facility, nor the buyer, the employer outside of federal healthcare, or the individual understands what anything costs or why. And then they've instrumented a whole bunch of hurdles and hoops for both sides to be able to do anything.